Hello, my name is Claire Hines. I'm a cardiorespiratory physiotherapist, and today I'll be taking you through the active cycle of breathing technique, or ACBT. This technique is specifically designed to help improve your lung function and to reduce your shortness of breath. Doing ACBT will help to open up your small airways and actually clear your airways of any mucus or phlegm that's been building up. It's important to get this technique correct and make sure that it's done properly. So let's get started and I'll take you through. Today, I have Rebecca with me, and I'm going to be taking Rebecca through ACBT, and you can follow along at home. Rebecca, the very first part of ACBT is called relaxed controlled breathing, also known as quiet breathing. This is the most important part of ACBT because this is the recovery. To begin with, I'd like you to put your hands on your belly, okay, put your feet flat on the floor and get into a very comfortable position. If you need a pillow behind your back or if you need to lean forward on something, that's okay. It's important that you get yourself into a very comfortable position, upright sitting. For this, can you drop your shoulders, feet firmly on the floor, and just relax your breathing. And I just want you to feel the rise and fall of your belly into your hands. I'm just going to put my hands on yours. Okay, so we're just feeling the rise and fall with normal, relaxed breathing. And all the time you're doing this, just try to remember to drop your shoulders, feet flat on the floor, and just feel the rise and fall in your belly. Sometimes you might need to completely flop your belly out to actually feel what it's like. And just feel your stomach moving in and out, which is a very normal part of breathing. During ACBT, we'll spend quite a bit of time in this position, doing relaxed controlled breathing. Good. We're going to move on to the next stage, which is known as a few different things: thoracic expansion exercises or deep breathing. When I take Rebecca through this for the first time, I'm going to be putting my hands on Rebecca's chest. You can do this at home by putting your hands on your chest here. So Rebecca, I'm just going to put my hands on the sides of your chest. Okay. And what I'd like you to do is take a very big breath in. As big as you can, big as you can, big as you can. Don't hold it and relax straight out. Good. Okay, and again, big breath in, and out all the way. Remember, don't hold your breath. Just a nice big breath in, as deep as you can, and out. And Rebecca, we're going to do one more. Big breath in, and relax. Good. I'm going to go straight back to relaxed controlled breathing. Good. During deep breathing, it's very normal to feel short of breath. When you're doing deep breathing, you may only be able to make 2 breaths before you get too short of breath and you need to come back to relaxed controlled breathing, and that's okay. The important thing is that this is done within your comfort zone, knowing that you will get short of breath when doing this, and the relaxed breathing is what will help your recovery. How long you do relaxed controlled breathing for doesn't matter. For some people it will be 30 seconds, for other people it might be 2 to 5 minutes. The important thing is that ACBT is done within your own pace. When you're thinking, have I done enough relaxed controlled breathing? I want you to think to yourself, could I speak in a full sentence right now? Would I be comfortable talking to a friend with how short of breath I'm feeling? If the answer is yes, then you're ready to carry on and do another set of deep breathing. If you're not ready, that's okay. Carry on doing your relaxed controlled breathing. And remember to drop your shoulders, keep your feet firmly on the floor, and feel the rise and fall of your stomach, of your lungs through your stomach, okay? Nice, slow breathing. So Rebecca, how are you feeling?
Good.
Okay. Are you okay to proceed with another set?
Yes.
Okay. So we're going to go now to another set of deep breathing exercises. This time, Rebecca, I'd like you to put your own hands on your chest on the outside. And I'd like you to take your own really big breath in and feel the expansion of your lungs through the outside of your chest. Big breath in, don't hold it at the top, and then relax all the way out. Good job. And again, big breath in, and relax. Good. One more, big breath in, and relax. Can you do one more? Good job. Last one. In, and relax. Really well done. And put your hand on your belly. Good job. And just drop your shoulders, feet on the floor. A nice, relaxed, controlled breathing. So for those of you who have just done your second set of deep breathing, if you managed to do 2, well done. The important thing is putting your hands on your rib cage and feeling that expansion of your chest and relaxing again. The reason that we try not to hold the breath right at the top is sometimes that can create more shortness of breath, or for some people with further lung disease, it can actually cause more problems. So always try to keep your throat open when you're taking a big breath in, and then when you're exhaling through the thoracic expansion exercise or deep breathing. Carry on with your relaxed breathing control. If at any point in this video you need to pause it and actually have a longer, quiet breathing or relaxed breathing control, please feel free to do so. And remember, a really good indication is that if you can talk to a friend in a full sentence if they were there, then you're ready to proceed with the next set of deep breathing. Rebecca, how are you feeling?
Feeling all right. Feeling good.
Are you ready to go with the last set?
Yes.
Okay. So during ACBT, as you can see, it's 3 sets of these deep breaths that we actually do. The 3 sets are important because we're actually managing to get some of the airways open. And for those of you who have still got some phlegm or some mucus in your airways, those sets are actually helping mucus to come further up the airway so you can actually relieve your airways of that phlegm or mucus. Okay, so we're going to do the last set of your deep breathing or your thoracic expansion exercises now. Okay, so pop your hands on your chest. Okay, and big breath in. In, and relax. And again, big breath in. In, and relax. Last one. Big breath in. In, and relax. Really well done. And just go back to your quiet breathing. So hands on your tummy, relax your shoulders, feet firmly on the floor, feeling your toes on the ground and your heels. Really well done. Keep going with your relaxed controlled breathing for now. Recovery is the most important part of ACBT because it's what enables you to continue with your thoracic expansion or your deep breathing, and it enables you to actually get the phlegm up or to actually open up your airways, which is incredibly important with long COVID. When we're doing our deep breathing exercises or our relaxed controlled breathing, it doesn't matter if you breathe in and out through your nose or your mouth. You'll hear a lot of people say, take a deep breath in through your nose and then out of your mouth. For this particular scenario, it doesn't matter because we're really focused on what's happening inside your lungs. So actually getting the air down into the lungs is going to be the most important. Some of you might have quite congested nasal passages and you'll need to breathe in and out through your mouth, and that's most important. It's what is comfortable for you. So as you're recovering through your relaxed, controlled breathing, remember, hands on your stomach, feeling the rise and fall of your belly, relax your shoulders, drop the shoulders down and feet on the floor. Good. If you need to pause this at any time, please remember you can, and make sure that when you're ready to do the next section, the next set, that you're able to speak in full sentences so you can proceed. Okay, while you're doing your relaxed controlled breathing, Rebecca, I'm going to explain the next section to you, okay, before we give it a go. The next section is called the forced expiratory technique, also known as a huff. Now, essentially, this is a cough, or this is how we clear the airways. But for people who are very fatigued or short of breath, a cough can actually be quite troubling, because the cough is actually going to cause a huge amount of pressure buildup. It's going to be increased fatigue, and it creates a lot of effort for us when we cough. So for this particular scenario, when we do a forced expiratory technique or a huff, what we do is we, instead of having a cough with a closed throat like this, instead of doing a cough, we keep an open throat at the back of the mouth. And we end up huffing, almost similar to fogging up a mirror, like this. When we do a huff or a forced expiratory technique, it's important to keep an open throat. Sometimes we get a bit enthusiastic and we end up closing our throat at the same time as trying to do a huff. And this is what it sounds like when we're not doing the huff correctly. Okay? If you find yourself doing that, try and relax a bit more and go slower. It may seem too gentle compared to a cough, but it's a very effective way of removing mucus. So Rebecca, I'd like you to give this a go now. It can be very helpful for the first time to imagine you have a mirror in front of you and put your hand up, okay? And just a medium-sized breath. Good job. When you're doing it, keep your mouth as open as you can, almost as if you have a tube that you've got your mouth around. Okay, good. A bit wider. Good. Okay, we'll do one more medium-sized breath. Good job. And back to relaxed control breathing. Well done. For some of you, performing a forced expiratory technique will start to bring up phlegm. And as you do, you will find it almost catches you in a cough, and that's okay. If you find that you have phlegm coming up, you can either spit it into a tissue, you can swallow it, but it's important that that phlegm actually does come up. If it comes up and you have it in a tissue, take a note of the colour, because sometimes your health practitioners will ask you, is your phlegm clear? Is it white? Is it yellow? Is it green? Is it brown? And all of these colours actually give us an indication if there's any infection. So when you bring up mucus, make sure that you take a note of it. If you do a huff and you catch yourself in a cough, that's okay. Going back to relaxed breathing control now, as Rebecca is doing here, brings you to the completion of one full cycle of the active cycle of breathing technique. Okay? Remember to drop your shoulders, keep your hands on your belly, feet firmly planted in the ground. It's very important to recover between each session. Now, this full cycle that we've just done and that you've completed at home, you need to do twice more now. And then that is one full session of ACBT. So you can rewind back to the start and go through this again, twice more. For long COVID patients, the evidence is really around regular ACBT. So completing this exercise once a day is going to help improve your exercise capacity. That means you'll be able to do more with less effort, which is fabulous. And it also means you'll be less short of breath. So this is a really crucial exercise to improve your quality of life, to improve your exercise capacity. And the great thing is that you can do it at home with no equipment, and it's something that you can integrate into your everyday life. Some people prefer to do this first thing in the morning, and some people do this at night just before they go to bed. And it can actually help them relax once they've finished. They find themselves very fatigued, And as they finish their last relaxed controlled breathing, it can help them go to sleep. Whether you do this in the morning or in the night, it really doesn't matter. The important thing is it's a regular part of your recovery.